I first noticed something in 2008. I would wake up in the morning to my alarm clock, and I'm a side sleeper. I would be sleeping on one ear, and I'd wake up, roll over to turn the alarm clock off, and the pitch of the alarm clock would change. My hearing loss became a bit more rapid after about 6 months, and then finally increased very, very quickly. And at that point, I saw a doctor around 9 months of having the condition. And he gave me a basic hearing test and then referred me to an ear, nose, and throat specialist, at which point I had an MRI, and that came back with no tumors, thankfully, no cancer, no acoustic neuroma, but also with no answer as to why I lost my hearing. Once I had lost my hearing and knew that it wasn't going to come back, that it was I was a bit fearful and disappointed, and it certainly has impacted my life in interpersonal ways. Talking with people, being in groups and social settings, in a room full of people, like I'm gasping for air or drowning, and I simply want to get out of that room, and I feel better on the outside. I'm tasked with going to engineering meetings at work, and we were sitting around, maybe a group of 15 people around a dinner table, and the gentleman leading the meeting was sitting right next to me. And suddenly I realized that it was quiet in the room, and everyone was looking at me. And what I didn't realize was that he had turned to me and asked me a question. And you're not typically looking at the person right next to you all the time, you're listening. But he had literally asked me a question, and I didn't hear it, or it disappeared into the background noise. And I looked around, and everyone's looking at me, and I looked over at him, and I said, "Oh, I'm sorry, could you repeat that?" And at that point I realized, wow, this is a challenge, and it's going to impact my ability to do my job. At that point, the audiologist presented me with my options. How can we help you, John? And there were several devices out there. One of those was a surgical device, and that one I did a little bit of research on my own on the internet. I read some testimonials on that. I think initially I objected to that because it would protrude. It would be something on the side of my head. I wear a hard hat in the field as part of my job as a geologist. I figured that might intrude on that or rest on it. That would be uncomfortable. Aside from that, I don't have a lot of hair on my head to hide something like that, so that was another consideration. Not that I worry too much about that, but one of the things that I wasn't really thrilled with was the idea that I would have to go through that surgery to begin with. That was something that was, drilling into my skull was not something I wanted to do. The other option that was presented to me, which was the SoundBite hearing device, was non-surgical. It's something I could take off at night and very much less intrusive in my life. I didn't know what to expect with the SoundBite device, but I'm very pleased with it. The quality of the sound is incredible. It is really amazing to be hearing through my tooth, and those sounds are coming in just as they would normally. I think the first sound that I heard through the SoundBite device, I stepped outside and I could hear cars, people talking, that kind of a thing. That was a big deal for me because I had almost been hit by a car twice without the device, and was having to adjust to that. So now suddenly I could hear those cars coming from my left side. So this is my ITM device, or in-the-mouth device, part of the SoundBite system. When it was introduced to me and I first wore it, it felt different for sure, but it did not take very long to get used to that. And I would say within a few weeks, I had come to the point where I didn't really realize it was there in my mouth. I would tell anyone who suffers from single-sided deafness to definitely seek treatment. In my own experience, it has had an impact on my social life, my ability to interact with people, And if you're suffering from that at all, pursuing SoundBite is going to improve your quality of life in that respect. And every once in a while, if I get busy, I'll walk out the door, head to work without it. And it's not a situation that I really like to be in. I find myself once again going through the very same things that I experienced at the beginning when I first had the hearing loss. So the condition exists no matter what. Without the device on a given day, I definitely feel that void on my left side. The absence is very apparent, and it's apparent right away. It's been a real benefit to me to be able to hear and to take sound in from my bad side. It has changed my life profoundly. I don't know where I would be right now without the SoundBite device.